there, I am Brittany Spalding. I am part of the Physician Relations Department here at Reston Hospital, and today we have Dr. Evelyn Felluca with us. Thank you for joining us, Dr. Felluca.
Thank you for inviting me.
So Dr. Felluca is a board-certified gynecologic surgeon. She's been practicing in the Northern Virginia area for 30 years. She started the robotics program in gynecology in 2009. She has had 10 years of experience with robotic surgery and performed approximately 1,000 cases using this advanced technology. So today we are going to ask Dr. Felluca a couple of questions, and she is going to give us some great answers. So Dr. Felluca, let's start off. I'm going to start by asking you, why robotics?
Well, let me take you through the evolution of minimally invasive surgery. When I trained in the late 1980s to the 1900s, hysterectomies were either open, large incision, or they were vaginal hysterectomies.
Okay.
Laparoscopy was still in its infancy at that time. So laparoscopy, I'll explain to you what that means, entails doing surgery through very small incisions through the abdomen, and then placing trocars, these are considered trocars, both of these, in those incisions, and then placing the instruments in the incisions to perform the surgery. So the first laparoscopic hysterectomy was performed in 1989. When I first saw this, I was hooked. I thought, this is really, wow, this is great. This is really, I have to learn how to do this like a kid in a candy store. However, laparoscopy at that time was, imagine going through, this is the laparoscope, looking through the viewpiece and looking in the incisions in the patient's abdomen and tilting it at a 45-degree angle. Can you imagine doing surgery for a long time in that position?
Very uncomfortable.
Over time, the innovators actually put the large camcorders in the 1980s and 1990s on their shoulders and then put them on poles so they could actually visualize the surgery. And then ultimately, and we still have these now, cameras that are placed on the top of the laparoscopes so they could shoot the image on a live on a TV screen. That's what we have in the operating rooms now. So in 2005, robotics came along. Robotic assisted surgery was approved for use in gynecology.
Fantastic. Now let me ask you, what is robotic assisted surgery?
So robotic assisted surgery is not morning, Will Robinson. It's basically laparoscopy on steroids.
Okay.
It's taking conventional laparoscopy, what we have here,
Okay.
and moving it into taking laparoscopic surgery and basically changing it so that visualization, precision, everything is improved. If I take you through that, it's a win-win situation. You're using the same trocars, except the fact, and you're putting the instruments in. This is one of the instruments that's in there, and it's very precise, it's very delicate. You can see that the tips are very fine and very refined. So the instruments are placed in the trocars the same as they were before, except they're connected to the robotic arms. So instead of being back and forth, they're pivoting like this. So there's less torque on the skin and less pain.
Okay.
That's a start. Then the robotic system the robotic arm holds the camera port so I can operate with both hands. Once these instruments are placed in the abdomen through the incisions, I move to the viewport or the console right next to the patient, and I sit down, I put my head in the view screen. I have two cameras, one each eye, 3D, high definition, so I can see very clearly. I move my hands, which just like my hands outside the patient or inside the patient with the instruments, and I can do all the precise, unparalleled precision and manual dexterity, moving the instruments inside the patient. So my feet control the camera, so I can see inside the patient, and the other pedals are for cutting or coagulating, which is burning, and then I can also sit comfortably, which is great.
Absolutely.
Okay. So if I can see better, I can be more comfortable, certainly less fatigued, and I have better precision. I should be able to do better surgery, right?
Absolutely.
So for this reason, robotics is a real game changer.
So what other reasons would you say robotics is a big game changer?
Well, back in the United States, ultimately we performed 600 hysterectomies in the United States annually.
Okay.
So remember, the first laparoscopic surgery, hysterectomy, was performed in 1989. Before 2003, over 60% of hysterectomies were performed open, cut, large incisions.
Wow.
These are associated with more pain, more blood loss, taking longer to recover.
Absolutely.
And also limited being able to visualize what's in the abdomen because you're looking through a hole. If you have a large mass, you can't see below it. Only 14% of hysterectomies were performed laparoscopically. Why? Because it's so difficult. It's hard to perform these surgeries. The visualization is not as good, the instruments are not as flexible, and ergonomically you have to lean over the patient, which is not as comfortable for the surgeon.
Sure.
So for those reasons, even though it's been around, laparoscopy's been around, conventional laparoscopy's been around for 20 years, it was never really adopted by many surgeons because it's so difficult and technically challenging.
Okay.
So vaginal hysterectomies, likewise, only 10 to 15% of surgeons do vaginal hysterectomies.
Okay.
Because they're working through a long tunnel, vagina. So if you have a large mass, you can't see the mass through the vagina. You can't see endometriosis, large masses, or even large uteruses can't come down that way.
Right.
It can be very difficult as well.
Absolutely.
So finally, when the robot came, this is the only advanced technology that's allowed surgeons to be able to do more minimally invasive surgery. So rather than being over 60% open cut, we were actually down to 46%, which is still pretty high, but it's actually helped surgeons perform minimally invasive surgeons more complex cases.
Absolutely.
So we have a long way to go. It should be a lot lower than 46%, but still it has really helped us. So robotics has assisted me as a surgeon to perform many more complex surgeries in a minimally invasive way. It does not do the surgery. It's just a tool.
That's fantastic.
Okay? In the hands of the right surgeon, a person that does a lot of surgery, high volume, patients from 1/2 to 1/4 of the patients have less complications, less blood loss, less time in the hospital. They go home 99% of the time the same day. And they're less likely to come back to the hospital for be readmitted, which is great for the patient.
Absolutely.
When they get back to work, the recovery is so much faster. They're also less likely to go in thinking they're having laparoscopy and end up with a big incision because there's less conversions to an open surgery. Most surgeons are able to do these procedures. My open procedures, my abdominal hysterectomy rate is less than 1%.
Wow, it's fantastic. So, with leaving on that note, what other robotic surgeries do you perform?
Right. Robotics shines in multiple different things, but the people that have very large uteruses, a normal uterus weighs 40 to 60 grams, and I've taken out close to 3,000. That's pretty big.
Wow. Yes, it is.
It's great in cases like high BMI. Everybody's a size 6 on the inside, which is great. So I've done BMIs of 70. That's pretty high.
Wow. Yes.
Endometriosis, it's very delicate surgery. You can have a lot of scar tissue. People that have had prior surgeries in the past can have a lot of scar tissue and adhesions. Also myomectomies, taking out fibroids. For people who can't have kids or want to preserve their uterus, keep their uterus and have kids. Sometimes taking out myomectomies, taking out fibroids, or people that just want to keep their uterus.
Yes.
And the other one is prolapse surgery. When people's uteruses have a tendency to fall, it requires a lot of stitching, a lot of suturing, just like the myomectomies. It makes it so much easier. I can move my hand like this, and it's moving the instruments inside the patient.
That's amazing. It really is. So on that note, also, I've been staring at this, I feel, the whole time. What does your badge mean?
This is our Center of Excellence in Minimally Invasive Gynecology at Reston Hospital.
Okay.
I spearheaded this in 2012, and we received our first accreditation in 2013, and we're up for another one this October.
Wow, fantastic.
So this is, in this particular Institute of Minimally Invasive Surgery at Reston, we constantly try to improve and make it better for our patients. Everybody gets educated about patient outcomes, patient education, what to expect when you get into the operating room, what to expect when you go home. And we train all the people that are here so that everybody that comes in contact with the patient really understands how to give the patient a superior outcome by taking great care of them.
That is fantastic. Well, everybody, this is Dr. Felluca. We really appreciate you joining us today.
Thank you so much.
You're amazing. Thank you for bringing all of your tools.
My toys. Thank you.
So that is all we have for you today, guys. But please stay tuned for more news from Reston Hospital.